Sexuality is part of a person's personality and is important for overall health. Even though discussion of sexual topics has increased over the years, many adults lack knowledge regarding sexuality. Although patients may be hesitant to bring up their concerns, they often share their feelings when nurses address sexuality in a related, matter-of-fact manner. To feel comfortable addressing sexuality, nurses need therapeutic communication skills to be knowledgeable about sexual functioning, issues, and assessment. Religious teachings, cultural influences on gender roles, beliefs about sexual orientation, and social and environmental climates influence the value systems for both patients and care providers. It is necessary for nurses to recognize that many values and issues surround sexuality. Sexuality differs from sexual health. People who are sexually healthy take a positive and respectful approach to sexuality and sexual relationships. They have the potential for having pleasurable and safe sexual experiences that are free from coercion, discrimination, and violence. Nurses' attitudes towards sexuality vary and often differ from those of patients. Be sensitive to patients' sexual preferences and needs. A basic understanding of sexual development, sexual orientation, contraception, abortion, sexually transmitted infections is necessary for nurses to help patients. Sexuality is related to all dimensions of health. Therefore, address sexual concerns or problems while providing routine nursing care. Sexuality is part of each individual's identity and includes biological sex, gender identity, gender role, and sexual partner preference. Attitudes toward sexuality vary widely. Religious beliefs, values of society, the media, the family, and other factors all influence it. Each stage of development faces a different task about sexuality. To be effective in promoting sexual health, nurses need to understand the normal sexual changes that occur as people age. Adolescence is often the time when individuals explore their primary sexual orientation. They may identify with a sexual minority group such as lesbian, gay, bisexual, or transgender, often referred to as LGBT. Adolescents often face significant stress related to these choices and benefit from education about sexuality issues. Support from peers, family, school counselors, clergy, nurses, and other health professionals is important during this time. Many stereotypical myths remain about people who are LGBT. Current evidence indicates that they experience decreased access to health care and do not readily seek preventive care. Non-judgmental nurses who have a solid knowledge base help to discourage these myths and provide nursing care that includes attention to the person's sexual orientation. Sexual development begins in infancy and involves some level of sexual behavior or growth at all developmental stages. During early childhood, children become aware of differences between the sexes. They begin to perceive that they are either male or female and interpret the behaviors of others as behavior appropriate for a female or male. During the school years, parents, educators, and peer groups serve as role models and teachers about how men and women act with and relate to one another. They need accurate information from home and school about changes in their body and emotions during this period and what to expect as they move into puberty. The emotional changes that occur during puberty and adolescence are as dramatic as the physical ones. Individuals face many decisions and need accurate information on topics such as body changes, sexual activity, emotional responses within intimate sexual relationships, sexually transmitted infections, contraception, and pregnancy. Intimacy and sexuality are issues for all young adults, whether they are in a sexual relationship, choose to abstain from sex, remain single by choice, are homosexual, or are widowed. Changes in physical appearance in middle adulthood sometimes lead to concerns about sexual attractiveness. Decreasing levels of estrogen in perimenopausal women lead to diminished vaginal lubrication and decreased vaginal elasticity. Both of these changes often lead to dyspareunia, or the occurrence of pain during intercourse. Decreasing levels of estrogen may also result in a decreased desire for sexual activity. As men age, they are likely to experience changes such as an increase in the post-ejaculatory refractory period and delayed ejaculation. Later in the adult years, some individuals have to adjust to the social and emotional changes associated with children moving away from home. Sexuality in older adults is an important aspect of health that is often overlooked by healthcare providers. The excitement phase is prolonged in both men and women, and it usually takes longer for them to reach orgasm. The refractory time following orgasm is also longer. Both genders experience reduced availability of sex hormones. A positive correlation is noted between sexual activity and physical health in older adults. Adolescents function within a powerful network of peers as they explore their sexual identity. In the United States, approximately 46% of high school students report that they've had sexual intercourse at least one time, and 14% of high school students have had 4 or more sexual partners. One reason why adolescents are sexually active is because many believe that sexual intercourse helps them achieve goals of intimacy, relationships, and pleasure. A substantial number of sexually active teenagers do not protect themselves from pregnancy or STIs. The dynamics of sexual risk-taking are not fully understood, but studies have found correlations among drug and alcohol use, sexual abuse, and unsafe sex. Adolescents tend to think that unwanted pregnancy, STIs, and other negative outcomes of sexual behavior are not likely to happen to them. Parents need to understand the importance of providing factual information, sharing their values, and promoting sound decision-making skills. They need to know that, even with the best guidance and information, adolescents make their own decisions and need to be held accountable for them. Numerous contraception devices are available to sexually active couples. Unplanned pregnancies occur, contraceptives are not used or used improperly. Although abstinence from sexual intercourse is 100% effective, it is often difficult for both men and women to use this method consistently. Any act of unprotected intercourse potentially results in pregnancy and exposure to STIs. Barrier methods include over-the-counter spermicidal products and condoms. Spermicidal products are put into the vagina before intercourse to create a spermicidal barrier between the uterus and ejaculated sperm. A condom is a thin rubber sheath that fits over the penis to prevent entrance of the sperm into the vagina. A diaphragm is a barrier method that must be used with spermicide with each sexual encounter. Vaginal spermicides and condoms are most effective when instructions are followed carefully. Their combined use is more effective in preventing pregnancy than the use of either one alone. Non-prescription methods of contraception based on physiological changes of the menstrual cycle include rhythm, basal body temperature, cervical mucus, and fertility awareness methods. Couples who use these methods need to understand the reproductive cycle of the woman's body and the subtle signs and signals that her body gives during the cycle. To prevent pregnancy, couples abstain from sexual intercourse during the designated fertile period. Many methods that are effective for contraception are not effective against STIs, for example, the pill and IUDs, or intrauterine devices. The prevalence of STIs is a major health concern for several reasons. Black and Hispanic populations are diagnosed with STIs more frequently than whites, and women have more complications associated with STIs than men. In addition, social factors such as poverty, low literacy, discrimination, the use of illegal drugs, incarceration, sexual abuse, and racial segregation contribute to racial disparities in STI rates. The site of transmission is usually genital, but sometimes it's oral genital or anal genital. People most likely to be infected share one key characteristic: unprotected sex with multiple partners. Gonorrhea, chlamydia, syphilis, and pelvic inflammatory disease are caused by bacteria and are usually curable with antibiotics. Patients need to take antibiotics for the full course of treatment. However, an emerging concern is that some of these bacterial infections are now developing antibiotic-resistant strains. Infections such as genital herpes, human papillomavirus or HPV, and HIV are caused by viruses and cannot be cured. Because sexual behavior often includes the whole body rather than just the genitalia, many parts of the body are potential sites for an STI. The ears, mouth, throat, tongue, nose, and eyelids are sometimes used for sexual pleasure. The perineum, anus, and rectum are also frequently included in sexual activity. People sometimes do not seek treatment because they're embarrassed to discuss sexual symptoms or concerns. They're often hesitant to talk about their sexual behavior if they believe that it is not normal. Any sexual behavior that embarrasses the patient may hinder detection of an STI. Development of communication skills and a non-judgmental attitude to provide effective care to those diagnosed with one. Detect valuable clues about an STI by establishing trust, talking with patients, and asking questions in a caring manner. Assess attitudes towards sexuality and adjust the intervention to make it acceptable to the patient's sexual value system. Populations at risk for HIV include people who use illicit IV drugs and share needles, individuals with hemophilia, and people who have unprotected sexual contact. The third stage of HIV infection, acquired immunodeficiency syndrome, happens when the person begins to show symptoms of the disease. AIDS is a serious, debilitating, and eventually fatal disease. Approximately 6 million new infections with HPV are identified every year in the United States. Most HPV infections are asymptomatic and self-limiting. However, certain types of HPV can cause cervical cancer in women and anogenital cancers and genital warts in both men and women. Chlamydia is the most commonly reported bacterial STI in the United States, affecting about 2.8 million Americans each year. And most chlamydial infections go undiagnosed and untreated because 75% of women and 50% of men experience no symptoms. People assign different meanings to sexuality based on their gender, culture, education, socioeconomic status, and religion. Pregnancy and menstruation practices vary among cultures. Some cultures encourage sexual intercourse or male-female contact during menstruation and pregnancy, and other cultures strictly forbid it. Research has found no physiological contraindication to intercourse during menstruation or during most pregnancies. Female sexual interest tends to fluctuate during pregnancy, with increased interest during the second trimester and often decreased interest during the first and third trimesters. Sexuality is a significant part of each person's being, yet sexual assessment and interventions are not always included in healthcare. Sometimes nurses avoid discussing sexual issues with patients because they lack information or may have different values from those of their patients. If you're uncomfortable with topics related to sexuality, the patient's unlikely to share sexual concerns with you. Pregnancy, whether planned or unplanned, significantly affects the life of the mother and father and often their support network. Choice of contraception method varies in relation to age, marital status, income, education, and previous pregnancies of the woman. Sexual biases, comfort with touching genitalia, desire for future fertility, financial status, ability to plan sexual contact, and ability to communicate with the sex partner all affect the choice and use of effective contraceptive methods. Half of all pregnancies in the United States are unplanned. Most unplanned pregnancies occur in teenagers, women over 40, low-income non-white women. Almost half of unintended pregnancies end in abortion. Abortions have been performed since ancient times. The safety and availability of abortions in the United States improved after 1973 when the Supreme Court decision Roe v. Wade was handed down. This established the right of every woman to have an abortion. Abortions are safer and less costly when performed in the early weeks of pregnancy. Be aware of personal values related to abortion. If caring for a patient contemplating abortion, provide an environment in which the patient is able to discuss the issue openly, allowing exploration of various options with an unwanted pregnancy. Discuss religious, social, and personal issues in a non-judgmental manner with patients. The subject also includes the issue of safe sex, as some religions or cultures do not endorse the use of barriers. Responsible sexual behavior includes knowing one's sexual partner, being able to openly discuss sexual and drug history with the partner, not allowing drugs or alcohol to influence decision making, and using protective devices. Choices available for singles or couples include pursuit of adoption, medical assistance with fertilization, and adapting to the probability of remaining childless. Sexual abuse is a widespread health problem. Abuse crosses all gender, socioeconomic, age, and ethnic groups. Sexual abuse affects physical and psychological health. Nurses need to assess for sexual violence to help patients confront these stressors and to educate individuals regarding community services. Cues that raise the question of possible sexual abuse include extreme jealousy and refusal to leave a woman's presence. The overall appearance is sometimes that of a very concerned and caring husband or boyfriend, when the underlying reason for this behavior is very different. Rape victims often need to work through process before feeling comfortable with intimate expressions of affection. The partner needs to know how to help and support the victim. Children who have been sexually molested need to understand that they are not at fault for the incident. Parents need to understand that their response is critical to how the child reacts and adapts. Ideally, sex is a natural, spontaneous act that passes easily through a number of recognizable physiologic stages and ends in one or more orgasms. In reality, the sequence of events is more the exception than the rule. Nurses meet patients who have problems with one or more stages of sexual activity, including the feeling of wanting sex, the physiological processes and emotions of having sex, and the feelings experienced after sex. The box 34-3 on page 679 presents illnesses and medications that affect sexual functioning. Be sure that you take a look at that. In gathering a sexual history, consider physical, functional, relationship, lifestyle, developmental, and self-esteem factors that influence sexual functioning. Include a brief review of sexuality whenever assessing a patient's level of wellness. Have a thorough understanding of safe sex practices and the risks and behaviors associated with sexual problems to anticipate how to assess a patient and interpret findings. Patients may have different customs and values from those of the nurse. Professional standards require respect for each patient as an individual. Confirm factors that potentially affect sexual desire and determine with the patient the extent to which sexual function is impaired. Issues in a relationship can often affect sexual desire. Problems with a person's self-esteem frequently lead to conflicts involving sexuality. Box 34-5 on page 681 gives you nursing assessment questions. PLI-SSIT Assessment of Sexuality. Permission to discuss sexuality issues. Some individuals are too embarrassed or don't know how to ask sexual questions directly. This assessment model helps nurses discuss these with the patients in a relaxed but matter-of-fact manner. Limited information related to sexual health problems being experienced, specific suggestions only when the nurse is clear about the problem, and intensive therapy referral to professional with advanced training if necessary. Recognizing both subjective and objective signs and symptoms of abuse in children and adults aids in identification of this too common problem. The sexual counseling of minors raises ethical and legal issues regarding the patient's rights to health care and education on the one hand, and the parents' or guardian's right to supervise information on the other. Children and adolescents frequently respond when they know that having questions related to sexuality is normal. Sexual dysfunctions result from varied and complex causes. Instruct both men and women on the signs and symptoms of STIs during the examination when patient's history suggests risk for STIs. Table 34-1 on page 681 presents signs and symptoms that indicate possible current sexual abuse or history of sexual abuse. Possible nursing diagnoses related to sexual function are listed on the slide. Assessment data that signal a nursing diagnosis related to sexuality often include a history of surgery on reproductive organs, changes in appearance or body image, a history of or current physical or sexual abuse, chronic illness, or developmental milestones such as puberty or menopause. To make a nursing diagnosis related to sexual dysfunction, consider anatomical, physiological, sociocultural, ethical, and situational issues thoroughly. It is necessary to understand the limits of your knowledge base and to include other healthcare providers such as sex therapists, clinical psychologists, and social workers as appropriate to meet patients' needs for sexual health. Most nursing interventions that enhance sexual health require providing education. Interventions for sexual dysfunctions depend on the condition and the patient. They often include giving information, teaching specific exercises, improving communication between partners, and referring patients to a knowledgeable professional. Individuals who have more than one sex partner or whose partner has other sexual experiences need to learn about safe sex practices. Help patients to anticipate how their illness or disease will change over time and the adjustments that will be necessary to achieve sexual fulfillment. In a long-term care setting, facilities need to make proper arrangements for privacy during resident sexual experiences. Evaluate outcomes of care by talking with patients regarding satisfaction with sexual functioning and through observations of nonverbal behaviors that suggest anxiety. Include the partner when appropriate. When outcomes are not met, begin to ask questions, such as those on the slide, to determine appropriate changes and interventions.